Good evening, sorors of Alpha Kappa Alpha Sorority Incorporated, and welcome to you and our invited guests this evening who have joined us for Alpha Kappa Alpha's This is a Serious Matter, COVID-19 Vaccines and Variants virtual forum and town hall. It is a great honor and great humility that I greet you on behalf of the leadership of Alpha Kappa Alpha Sorority Incorporated as your moderator for this evening. Where 2020 saw the development and testing of vaccines against COVID-19 at an unprecedented pace, the first half of 2021 has seen vaccine rollout across the globe. During this evening's Town Hall and Forum, we hope to provide a snapshot of ongoing vaccine efficacy as well as real-world information on vaccine effectiveness and the impact of the virus variants of concern. It is really clear that where they have been deployed in a high proportion of the adult population, the current approved vaccines have been extremely effective in preventing COVID-19, particularly severe disease. Nonetheless, there are still significant challenges when it comes to vaccine hesitancy among the general population and the Black and Brown communities in particular. Tonight, we plan to tackle the serious matter of vaccines and variants. To get us started, I'm happy to welcome again our esteemed leader, Dr. Glenda Glover, to officially open this evening. And of course, I have to introduce her appropriately. Dr. Glenda Glover is the leader of Alpha Kappa Alpha Sorority Incorporated, the oldest Greek letter organization established by African American college women, an organization of nearly 300,000 members in over 1,000 chapters located all over the world. Dr. Glover is a certified public accountant, a licensed attorney, and one of a handful of African American women to hold the PhD, CPA, JD combination in the United States. Professionally, Dr. Glover serves as the president of Tennessee State University, her beloved alma mater, and is the institution's 8th and 1st woman president. She knows, out of respect and deference, I refer to her as Madam Supreme, so it's only fitting that she opens the evening with a welcome to all of our sorors from across the world and our guests who've joined us this evening. It's my pleasure to welcome Dr. Glenda Glover.
Thank you, Star, for that presentation and for being such an amazing moderator for this all-important session. It is a rich privilege to greet you on behalf of Alpha Kappa Alpha Sorority in this continuation of our Serious Matters series. I am delighted to recognize this incredible panel as we engage in a most significant, timely, and necessary discussion of vaccines and variants. I am pleased to remind us all that this administration has an unspoken theme of helping others. Alpha Kappa Alpha is a service organization, and we are proud to provide assistance and to serve our communities. We assemble on this evening to stress the importance of vaccinations, again, to help, to assist, help in the most meaningful way, and that is to save lives, to show and discuss how COVID-19 vaccines are effective in helping us protect against severe illness and death from variants of the virus, including the Delta variant. Fully vaccinated individuals have a high degree of protection, including protection from the Delta variant. Thousands of African Americans are not vaccinated. What affects one of us directly affects all of us indirectly and even directly. Our communities are still at risk. Our families are still at risk. Our friends are still at risk. Our workplaces are still at risk. And our schools and colleges are at risk. Tonight, Alpha Kappa Alpha is pleased to present this awesome panel of experts. Thank you for joining us tonight and continuing to engage with us as we try to make a difference by encouraging vaccination. God bless each of you.
Thank you so much, Dr. Glover. It's always an honor to work with you and to be in service to our sorority, our sisterhood. Ladies and gentlemen, all viruses, including the virus that causes COVID-19, evolve over time. When a virus replicates or makes copies of itself, it sometimes changes a little bit, which is normal for a virus. These changes are called mutations. A virus with one or more new mutations is referred to as a variant of the original virus. That's what brings us here today. Dr. Robyn Jones is a Senior Medical Director, Health of Women, Office of the Chief Medical Officer, Johnson & Johnson. She's a physician scientist, board-certified obstetrician gynecologist, educated at Brown University, Temple University Medical School, Medical College of Pennsylvania, and Duke Integrated Medicine, also the School of Life, as she likes to say. Dr. Robyn Jones is actively involved in the health of women, eliminating health disparities, maternal health, sex and gender research, and has presented extensively to lay and professional audiences on this topic. A life member of Alpha Kappa Alpha Sorority Incorporated and a member of our pandemic task force, she's going to open our town hall this evening and table set our discussion. So, Dr. Robyn, please take it away.
Thank you, Sora Star. I want to again welcome all our sorors and invited guests this evening, and we can get started with the presentation. So let me start. I'm going to start this evening just by kind of giving a little bit of the history that comes with the COVID-19 virus and remind us all where we started. December 31st, 2019. That is when China informed the world about SARS-CoV-2, the virus that's responsible for the COVID-19 pandemic we are currently experiencing. I have several topics that I'm going to go through. You can see them on the screen. And I want to start just in general by just talking a little bit about the coronavirus itself. And we can see that in the next slide. Continue. So this is the coronavirus. One of the things I want to remind everyone is that the common cold is a type of coronavirus. And that word corona comes from the appearance. If you notice, the virus has a crown of spikes all around it, protein spikes. Those spikes are most often what is transformed during a mutation. A mutation occurs, well, let's backtrack a minute. So with the coronavirus, viruses need cells in order to multiply. And I'll take the human cell as an example. They can also multiply in animal cells. But with the human cell, when it attaches, then it multiplies. Variants occur because in that multiplication, it's not always 100% a replication of the virus that entered the body. And so with those small changes that happen, and as I said, more commonly in the protein spikes, or that corona is where they happen, that's when a variant occurs. And as you can see in the next slide, a little bit of the history of the virus. As I said, it originated in Wuhan, China, in December 2019 is when the world was informed. The Alpha variant was in the UK in September of 2020 and was more contagious than the original virus. The Beta variant was found in South Africa and Nigeria in May of 2020 and was also more contagious than that Alpha variant. The Gamma variant was found in Brazil, but really was originally thought to come from Japan to Brazil in November 2020, and again was more contagious than that Alpha variant. And then the Delta variant, which was found in India in October 2020, and is the virus that has devastated India. If you recall on the news, the photos that we were being shown were heartbreaking of the bodies that had accumulated because of the Delta variant of the COVID-19 virus. There are at least 13 other variants. And I mean, I'm underestimating, I'm sure. Every variant is not of significance. There are some that there is definitely interest in, and those are the ones that we tend to hear more about. Moving on, I want to speak a little bit more about that Delta variant. First of all, it's more contagious than the original SARS-CoV-2 virus. There's some data suggesting that the Delta variant may cause more serious illness than previous strains in unvaccinated persons. Unvaccinated people remain the greatest concern with the Delta variant. The risk of breakthrough infections, although they do take place, that risk is low. And there are thousands who are fully vaccinated who will become infected and infectious with the Delta variant. The other thing to realize about the Delta variant, one of the reasons it's so much more contagious is because with this variant, what's most impacted is the cells of the respiratory system. So it has a predilection for the cells that are in our lungs. And therefore, that is one of the reasons it is more contagious. As you can see here, what the CDC has depicted, with the original COVID virus, maybe one person infected two. But now with the Delta variant, one person, because it's so contagious, may infect at least 5 other people. The vaccine protects you from hospitalizations, and hospitalizations usually indicate you have a serious illness, and it also protects you from death. Moving on. Continue. So how effective is the vaccine? Well, fully vaccinated people with the Delta variant can have breakthrough infections, as I mentioned, but they appear to be infectious for a shorter period of time than those who are unvaccinated. And one figure I definitely want you to keep in mind is that 99% of COVID-19 deaths are now occurring in unvaccinated people. A study of COVID-19 vaccines effectiveness in the UK, and I will mention that there are only 2 vaccines mentioned here, and that's because those are the 2 that received authorization in the UK. So the study was just done on these 2, and that's Pfizer and AstraZeneca. And both of those were shown to be effective against the Delta variant. And as you can see the numbers here for Pfizer in this UK study, it was 88% effective. For the AstraZeneca, which is not approved in the US, it was 60% effective. And that's after receiving both doses. If you only receive 1 dose, then the effectiveness drops to about 33%. So let's talk about refusal and hesitancy. There's a number of reasons why people hesitate and a number of reasons why they refuse. Some of the reasons are they're not worried, people aren't worried about the serious illness that they can get. They think it's not going to impact them. One of the things that was recognized is that folks who live in the regions that voted for Trump in 2020 or supported him in the 2020 election, they're also more likely to hesitate or refuse. There's not trusting the vaccine. There's not trusting the government. There's waiting to see if the vaccine is safe and or approved. Continuing on. What you're seeing here is a really colorful slide, and I just want to share what it's showing. So if you look at the green, or on the left-hand side of the screen, those already vaccinated are your advocates. Those are the individuals who can go out and tell the story and hopefully will be almost messengers about why individuals should get vaccinated. And there, in this particular study, they were about 18% of those in long-term care facilities who were staff. Then there's that large section, the yellow, the movable middle. So the movable middle has vaccine hesitancy for a number of reasons. But one of the things we can certainly focus on, that ways to move those folks in the middle, is we can make it easier for them to get it. We can influence and give them some motivation. And we could also show that the vaccine is safe. When we look at the far right in the red, those are the refusers. Those are the individuals who are 19% of them refuse, and 2 to 3% are actually putting out negative messages about the vaccine. They are the detractors. Moving on. So I just wanted to share, I can't really see my slides, so I'm kind of doing this from memory, just so you're aware, video person. So the other story in terms of vaccine hesitancy is who it is that's hesitating. First of all, it's young people, ages 18 to 24. Younger Black people are more hesitant than younger white people. The data also shows that older white people are more hesitant than older Black people. Non-Asian people are more hesitant. Those that are less educated, so less than or equal to a high school diploma. And those with a history of a positive COVID-19 test are also more likely to be hesitant or to refuse. Moving on. So what do we think about when we say vaccine hesitancy and refusal? There's still other reasons. There are people who are not worried about serious illness. There are those, again, not trusting the vaccine. There are those that have these conspiracy theories. And with the conspiracy theories, there is this group called the Disinformation Dozen. That's 12 individuals that have been identified by name that on social media are spreading disinformation. Probably the top 5 disinformation conspiracy theories are that the vaccine includes a microchip, that the vaccine alters your DNA, that the vaccine can be shed from one person to another, that the vaccine is what's causing the COVID-19 variant, and that the vaccine has already led to a large number of deaths. All of this is disinformation. All of it is a myth. The other thing that you may hear is that the vaccine causes miscarriages, also a myth. I think what we want to remember is that there are millions of people in the United States alone that have received the vaccine. And so the safety profile has been pretty well identified, and we know and can share what that safety profile is. Next slide, please. So let's talk about testing and more. What are some of the things we know about testing? Well, testing does save lives because it lets us know if someone's infected. Testing can be easy, can be quick, sometimes uncomfortable, but it's bearable. Testing matters more in communities where infections are the most. And I know that Dr. Stanford is going to talk about that. Testing is important for 2 reasons. First of all, it warns the individual that they have an infection. Second of all, it provides surveillance, and it's also making us aware of what variants are out there. That's accomplished through testing. One of the things to know that currently, if a person develops symptoms, following exposure, they should be tested even if they are vaccinated. Let me say that again. If you've been exposed, if you develop symptoms, even if you're vaccinated, you should get tested. After you're exposed, quarantine and testing is only necessary if you have symptoms. So if you've been exposed and you have no symptoms, you can get testing just for information's sake, but there's no medical necessity to have that testing done. So what do we know some more and more about COVID-19? First of all, there's things we don't know. We don't know how long you're protected if you've actually had the virus. That's one of the reasons why it's recommended that you get the vaccine, even if you've had the infection. We're hearing now, just in the last week, that vaccine boosters will be needed, and we are testing the immunocompromised first. They're the ones receiving the boosters, but ultimately everyone who's received at least the Pfizer and Moderna, those are the 2 that we know about thus far, will definitely need a booster. And it's recommended that you get that at least 8 months after you received your initial vaccine, and that's the completion of both doses. One of the reasons you want to get the vaccine, even if you've had the infection, is because your immune system has a memory. that memory gets supercharged when you give the vaccine. So you get an even stronger immune response to the virus. You ask, if I've had one vaccine, can I go get another? It's still under evaluation. We don't really have that data yet. One of the other things that's huge, and I want to share, is that the Pfizer vaccine was approved yesterday. It received full FDA approval on August 23rd. And as I mentioned, that's one of the reasons that people hesitate. I want to leave you with a couple of things, and one of them is the 4 numbers. When I talk about the 4 numbers, these are the ones I want you to remember. And these are numbers related to the United States. 627,000 people have died. 38 million have been infected. 170 million have received a full dose of the vaccine. That means 2 doses if you've received Pfizer or Moderna. 199 million have received at least 1 dose. And when I say that 1 dose, I'm only including those vaccines that require 2 doses. And the last but most important number is that of those vaccinated, only 1,250 have died. Can I say that again? Of those vaccinated, only 1,250 have died. I want to give you this safety example. So let's, we know that auto accidents are not uncommon, but we know that there's one main thing we need to do to protect ourselves against an auto accident, and that's to drive safely. The second thing we do is put on a seatbelt. Well, let's look at COVID the same way. The first thing we do is take all of the preventive measures. The second thing we do is get a vaccine as an ultimate safety measure. I just wanted to share a little bit what difference between a pandemic and an endemic. We are currently still in the pandemic phase because this infection is increasing worldwide. When we get to endemic, which is what the predictions are moving forward, the numbers will be stable and there'll only be occasional flare-ups. And when I say flare-ups, that's flare-ups in the numbers. So only occasional surges that will happen. But right now, we're still in pandemic mode. I want to leave you with this. Get vaccinated, mask up, socially distance, wash your hands, and if you have symptoms, isolate yourself from others until your test results have been received. On behalf of the Pandemic Task Force, thank you for your attention.
Sir, Dr. Robyn, we thank you so very much for that amazing presentation. And it can be daunting because it's information that can be frightening, but I believe very strongly that those who are forewarned are forearmed, and you have forearmed us with very vital information. And so now, ladies and gentlemen, it is my pleasure to introduce the power panel of medical professionals who will actually help us take a deep dive into the issues around the COVID-19 virus vaccine and variants that Dr. Jones so eloquently spoke about. The COVID-19 vaccines that are currently in development or have been approved are expected to provide at least some protection against the new virus variants because these vaccines elicit a broad immune response involving a range of antibodies and cells. Therefore, changes or mutations in the virus should not make the vaccines completely ineffective. To help us understand all these issues surrounding the vaccines and variants are 3 amazing Alpha Kappa Alpha women. First, Dr. Ayla Stanford. Dr. Stanford is a pediatric and general surgeon who's been a practicing physician for 24 years. She is board certified by the American Board of Surgery in both pediatric and adult general surgery and a healthcare advocate. She is the founder and CEO of the Black Doctors COVID-19 Consortium, BDCC. The consortium was formed in response to the disproportionate number of African Americans being diagnosed and dying with coronavirus in Philadelphia, Pennsylvania, and the lack of swift intervention to mitigate the disease's spread. The mission of the consortium is to educate, provide advocacy, and barrier-free coronavirus testing and vaccinations to decrease the morbidity and mortality associated with the disease. Her research in basic science, clinical research, and public health have been published in peer-reviewed medical journals. Dr. Stanford also serves as a medical correspondent for local and national news outlets. She serves on the CDC Philadelphia Department of Public Health COVID-19 Vaccine Advisory Committee. She is truly a pioneer and a trailblazer and committed to bridging the gap between minorities and quality public health services. We also have Dr. Sharrelle Barber. Dr. Barber is a social epidemiologist whose research focuses on the intersection of place, race, and health. Dr. Barber leverages state-of-the-art epidemiology cohort studies to examine how neighborhood-level structural determinants of health, such as concentrated economic disinvestment and racial residential segregation, impact cardiometabolic risk factors and cardiovascular disease onset among Blacks in the southern United States and in Brazil. Dr. Barber received a Doctor of Science degree in social epidemiology from Harvard, P.H. Chan School of Public Health, and a Master of Public Health in Health Behavior and Health Education from the University of North Carolina. North Carolina Chapel Hill, Gillings School of Global Public Health. Dr. Barber is committed to using her scholarship to make the invisible visible, mobilize data for action, and contribute to the transnational dialogue around racism and health inequity. She currently serves as an assistant professor of epidemiology and biostatistics at Drexel University, Dornsife School of Public Health, and serves on the Jackson Heart Study Scientific Council and co-chair of the Social Determinants of Health Working Group for the study. Dr. Barber is also an inaugural director of the UB-UNTU Center on Racism, Global Development, Global Movements, and Population Health Equity. And then finally, for Dr. Patrice Harris, served as the 174th president of American Medical Association and is the first African-American woman to be elected president of the American Medical Association. Having served on the AMA's Board of Trustees since 2011 and as chair from 2016 to 2017, she has long been a mentor, a role model, and an advocate. Active in organized medicine her entire career, Dr. Harris has served on the board of the American Psychiatric Association and was an APA delegate to the AMA. She's also been a member of the governing council of the AMA's Women Physicians Congress, a distinguished fellow of the American Psychiatric Association. Dr. Harris continues in private practice and currently consults with both public and private organizations on health service delivery and emerging trends in practice and health policy. She's an adjunct assistant professor at the Emory Department of Psychiatry and Behavioral Sciences and an adjunct clinical assistant professor in psychiatry and the behavioral sciences at Morehouse School of Medicine. She recently became CEO of EMED, a digital healthcare company. And so, as you know, you've done these town halls with me many, many times. Source who are watching this and our guests, and normally I don't spend as much time giving all the credentials of our panelists, but this is extremely important that you know that these are trusted voices when it comes to COVID-19 and the virus, the variants, and the vaccine. I want you to know that these are some of the smartest women, smartest physicians that we have in our community, and they're here to talk to all of you. And so I'll just put that question to you, the basic question. For doctors, why is it important that all eligible people over the age of 12 receive the vaccine? And Dr. Harris, I'm going to go ahead and start with you.
Good to be with you again, Source Star, and I also want to thank our beloved sorority for focusing on this issue. It is so important to make sure that our sorors and all of those lives who we touch get accurate information. So I'm so honored to be with you and to hear from our Madam Supreme and my fellow esteemed panelists. And the answer to your question, Source Star, is very simple. Vaccine saves lives. This is a deadly disease, disproportionately impacting communities of color, particularly African American. And so we have a vaccine that can prevent serious illness and death. And another point that we don't talk enough about are issues around long COVID, because some folks say, well, I'll get the illness, maybe I'll have a mild case and it will be over. And so we have the vaccine that can present, again, serious illness, the longer term side effects and deaths. And that is the reason we should get vaccinated, for ourselves and for those that we love.
I 100% agree. I remember, Dr. Harris, we talked when it was my turn and we were waiting in line because I had an underlying ailment, I'm a heart disease survivor. You made it very clear to me that this was not an option, that the vaccine was very important. And I listened to you and to my other doctors, but and I want to hear also from Dr. Stanford in this regard, because no matter how smart I think I am, I still had to come to you all to get all of the facts. So Dr. Stanford, please share with us why it is important that all eligible people over the age of 12 receive the vaccine.
Thank you again. And I'm going to also make it very clear and plain. COVID kills, period. It kills. And we all need to govern ourselves accordingly, regardless of your color, your gender, your economic status. It kills. Obviously, with Black and Brown communities, it impacts us at a greater rate, and that is our children, the healthcare workers, poor or rich. If you are Black or Brown, you are disproportionately more likely to be diagnosed and die from coronavirus disease. Another point that people don't mention, but Star, you mentioned earlier, are the variants. The variant has come about because COVID, the virus, was allowed to replicate and mutate and become stronger. It became unrecognizable. That's why it's not the Alpha variant anymore, and it's the Delta. And some of you have heard of Lambda. Lambda is because the Delta variant has changed its shape so much that it's becoming even more virulent, even more powerful, and harder to stop. So why we all need to get vaccinated is because it impacts us all if we can't prevent it. Right now, with the vaccines, it is preventable.
Dr. Stanford, that is as plain as it can come. And so, Dr. Barber, I'm going to put the same question to you because we've been having plain talk right now. It's your turn.
Absolutely. Well, thank you so much. And I just want to acknowledge just how powerful it is to be on this panel with Dr. Stanford. Really admire your work, and Dr. Harris. But again, I'll echo exactly what Dr. Harris and Dr. Stanford have said, is that, you know, this is a deadly virus that has been disproportionately impacting Black and Brown communities since the onset of the pandemic. And that the term that you mentioned that inaugural director of the Ubuntu Center, means I am because we are. In this pandemic, we realize that vaccines aren't just for ourselves and to protect ourselves, but it's to protect our communities, right? And so getting the vaccine, making sure we're continuing to take proper public health measures. It's about us, it's about our lives, but it's also about the lives of our families and our communities. And so we need to continue to advocate for the vaccine, continue to make it accessible to our communities, again, so we can create this blanket of protection around our communities so that we can get through this on the other side of this pandemic, right? It's been a long haul and we've lost a lot. You know, that number over 630,000 people just in the United States is sobering. And the fact that it's been disproportionately among our folks, we've gone to far too many funerals this year, is also sobering. And so we need to continue to do all that we can to make sure that we get through this vaccine and through this pandemic together.
Dr. Barber, I'm going to ask you to continue along this path of where you just sort of led us. How does the African American vaccination rates compare in relation to other demographic groups? I will share with you that according to the news media, that African Americans are far more hesitant. Well, I have to tell you, the African Americans that I know were in the front of the line trying to get that vaccine. So I would love to have you give us real information.
Absolutely. And I think that word hesitant is just And so in some ways it's problematic because there are a wide range of reasons that people have not received the vaccine. Some of those issues are related to access, including access to transportation and medical services, or access to information. So I hesitate to use that word just because there's so many wide-reaching or reasons that people are not vaccinated. But to give you the numbers as an epidemiologist, right now, we know that there are 72% of the total population have received at least one dose of the vaccine here in the United States. Blacks make up 12% of the total population here in the US, and we actually make up 15% of recent vaccinations. So most recent data from the CDC show that in the last 2 weeks or so, Blacks have been more likely to get the vaccine, very likely because of what's happening with the Delta variant. So that's good. And that kind of speaks to what our Sora earlier said about this movable middle, right? So there is room to move people to change their minds to get them to take the vaccine. We also know that, if you just look at the Black population, 40% of Blacks are vaccinated. That's compared to 50% of whites and 45% of Hispanics. But this varies across the country, right? So we know that there's some states where the vaccination level among Blacks is much lower. So in 33 states, vaccinations are less than 50% for Blacks. And these states include places like Alabama, Louisiana, even here in Pennsylvania, where the rate is 39%. And then are 6 states where the vaccination rates are less than a third among the Black population, among our communities, right? So again, we see variations, across states. And then the final thing, because I do work in kind of thinking about how this has played out in different communities, we know that those vaccination rates also vary by zip code, right? So there are zip codes in cities where rates are extremely low, and we need to be paying attention to that, right? Because that is where efforts like Dr. Stanford's, where they target communities where those numbers are low, we can get information, we can get access to those communities to make sure those numbers go up. So those are some of the most recent numbers from the CDC. I will give this caveat that there's a lot of missing data on race in these numbers. Only about 58% have data on race. So this is still not a full picture, but it's the best picture we have with the data we've been receiving on vaccines.
And you all know that when it comes to research in medicine and science, the numbers as it relates to African Americans can be skewed because we are often not participants in these research projects. And so we really do appreciate you shedding some light on the numbers, at least of where we are. You brought up the point that we all need to go ahead and deal with, and I would like to have us all on camera at this point, because we know that research has shown that there are some universal reasons for vaccine hesitancy, that word that we have heard constantly. Confidence, complacency, convenience or constraints, risk calculation, and collective responsibility. Promoting the uptake of vaccines, particularly those against COVID-19, will require an understanding whether people are willing to be vaccinated, the reasons why they are willing or unwilling to do so, and the most trusted sources of information in their decision making, hence this town hall tonight. The reasons for vaccine hesitancy can vary, but there are some common ones, and I thought we would address them one by one and just let's knock them out. So I'll start with you, Dr. Harris. Safety and efficacy concerns. There are individuals that believe that there's not enough science, the vaccine was developed too fast. It was, after all, a record time from conception to mass production. And until yesterday, with Pfizer vaccine being given full approval for those over 16, people have noted that the vaccines aren't even technically approved by the FDA since the agency had just authorized them for emergency use. Address the safety and efficacy concerns for me.
Well, thank you for that question. And let's go back even before we started talking about COVID-19. Work was already occurring on vaccine development, right? And so the mRNA technology that we see on these vaccines has been in development for over a decade. So I think that's the first thing that we need to recognize. So the foundation of these vaccines have been in development for years. And we all know about Dr. Kizzy Corbett, who was involved in the research. And I think that's been a very important point to make. But again, we have been, or they, researchers have been developing this technology for years. Now, it is absolutely true, because I like to make sure that we are saying what is true, right? And we don't shy away, just as we need to talk about the side effects that any of us experience, because we want people to have the full story. But it is true that this vaccine was developed in a short period of time. But that is because the federal government, and this was a very smart decision, decided to fund the development of multiple vaccines, right? They took a chance. Typically, we'll just fund one vaccine or a few vaccines, and they'll go from one phase to the next. There was a lot of money that was wisely appropriated to work on multiple vaccines on multiple timelines, and even to begin manufacture of some of those vaccines for the ones that won. So that was a chance, but certainly it was a money well spent and money well appropriated. So that also contributed to the speed. There were no shortcuts. The FDA and the committee at the CDC looked at the data, again, no shortcuts, and determined that enough data existed to give these vaccines the emergency use authorization. But again, there's rigor in that process. I want people to know that there's rigor in even the EUA. And of course, as we learned yesterday, Pfizer was given full approval. As I looked at the criteria, there are about 20 pages of criteria. And we now have an additional 6 months of data. So these vaccines work. They work to prevent serious illness and death. By the way, Sorstar, I think we all need to make sure that no one ever said you might not get an infection if you get vaccinated. It's that you won't get serious illness and need to be in the ICU or die. Any folks who have had the vaccine, if they experience any symptoms, these symptoms are usually mild. So I want everyone to know that if you look at the risk versus the benefits, these vaccines are very safe and they are very effective.
Dr. Harris, you made the point that my own doctor made to me, because as a heart disease survivor, she was concerned that what she didn't want me to do was end up on a ventilator in an ICU. And God forbid I should still get the infection, even though I'm fully vaccinated and have been for a while. That is so unlikely because of the vaccine. And I'm telling you, that was enough to convince me serious illness or death. So that's number one. Now let's go to number two. And Dr. Stanford, I'm going to give this one to you. Vaccine side effects are frightening and unknown as another reason there's hesitancy. So these are the individuals who are concerned about the actual vaccine itself, and particularly the side effects that can come with it. So these concerns may range from, okay, are we going to have a day or two of aches or fever or fatigue? In some rare cases, potentially blood clots. But they can also be about things that are not real or proven, or long-term health risks, or unproven claims like things like infertility. So address the vaccine side effects being frightening and unknown.
So the side effects can be broken down into acute, immediate, intermediate, and long-term. The acute side effects, which you commented, might be a sore arm, a queasy stomach. Some people have a fever, some people have chills. If you experience any of that, it's self-limited and will abate within 36 hours, at the most 48. Most of those symptoms are after your second dose. If you receive a 2-dose vaccine, there has been no evidence that the vaccines cause infertility. In fact, there are many women who receive the vaccine while trying to get pregnant while they were pregnant, after they delivered. But I can tell you this, as a pregnant woman, you are immunocompromised, you are more susceptible to a virus in your body causing harm, and it causes premature deliveries and possible fetal demise or death of an infant, and also death of a mother. And we also know that maternal mortality and infant mortality in the Black and Brown community is already high. So if anything, thinking about getting pregnant or pregnant, you should receive the vaccine. In terms of the intermediate effects, these are the things that usually happen within the first 90 days. There have been reports of Bell's palsy, which is where your face can be paralyzed on one side. Again, treated with anti-inflammatories. There's been descriptions about myocarditis, which is an inflammation in your heart. Again, self-limited and treated. And finally, the blood clots. And I should mention about the blood clots. People take oral contraceptives, you can develop a blood clot. People travel for long distances. They have sedentary jobs where they sit at their desk. You can have a blood clot. You drive an Uber, your foot is on the gas all the time, you can develop a blood clot. And so it's more that you can anticipate it, that if you have pain in your leg, that you have swelling and it's a new onset, that you go seek care from your doctor and acute medical attention. However, it's not a reason to say, I'm not going to get vaccinated, because these things may happen. Because statistically, if you are exposed to coronavirus, particularly now this Delta variant, and if you have a condition that makes you more susceptible, you're more likely to get very sick and die than have anything untoward happen to you from receiving the vaccine.
It sounds like a cost-benefit analysis to me. Dr. Stanford, and I look at the numbers and I weigh the cost-benefit analysis. Dr. Harris, I'm ready to go to this third one, which is the preference for physiological immunity, which is, these are the individuals who believe that the seriousness of COVID-19 has been, quote, exaggerated, and perceive the risk of vaccination to be greater than the risk of infection. Now, this is even after 18 months of living inside this pandemic. Some still don't see coronavirus as a serious threat. Shall we reemphasize the 600,000, or shall I just let you take this one on?
Star, I have to tell you, and as a psychiatrist, I still wonder how we are where we are, that folks don't appreciate the seriousness. And in all seriousness, I do understand, because there is so much misinformation and disinformation. And we heard Dr. Robyn talk about the infamous 12 folks. And of course, more than that, but so many folks are giving out just inaccurate information. And so, we see deaths. I mean, when I see the recent stories of children in ICUs, when I've seen the recent stories of the mom who gave birth and died 2 days later, and now we are seeing story after story of those who were unvaccinated, who died, and now their relatives are telling us. So that is the data. That is what's real. So we just have to keep talking about the numbers. And again, the 600,000 plus, as I have always said, that is certainly a data point, but those are lives, those are souls lost, and they had families and people who loved them. And so the data is clear. I, as a physician, I know my colleagues on the panel, we have been accused of lying, of inflating the numbers for monetary gain. Of course, none of that is true. And so the only way to continue to combat that misinformation is to participate in forums like these, but talk to our neighbors. And as physicians and epidemiologists, public health specialists, we talk to those within our circles, those who trust us, and continue to tell them the facts. And it's about being consistent and being relentless in the facts.
Thank you so much, Dr. Harris. Dr. Barber, I'm going to come to you with something that I know is a sore point for you, a pain point for you. Lack of access, whether it be real or perceived. It is true that access to the vaccine has dramatically expanded in the recent months, with the federal government now literally ordering and delivering far more doses than states can actually use. So a shot that once required an appointment, potentially weeks in advance, is now so abundant it's available walk-ins at many pharmacies and locales. But there's still some hurdles, and I don't want to discount those hurdles and those people who are in fact facing some of those hurdles. So can you address the lack of access, either real or perceived?
Absolutely. And I think we have to take a step back and say, well, what was happening even before the pandemic? And who lacked access to medical care and other kinds of services prior to the pandemic? Those same barriers are in place, right? Those same, in terms of time, in terms of distance, in terms of lack of transportation, in terms of jobs that aren't flexible, those kinds of barriers are still in place. And so we need to make accommodations. And I think that's happening some, but they still take place. And I'm also thinking about places, in rural areas, where it's a 30-minute, hour-long drive to maybe a pharmacy, right? Where so we're not just talking about, big cities like Philadelphia and other places. We're talking about places that literally lack access because of distance. And I think we need to remember that, right? And so I think what has been really powerful to see is where groups and churches have stepped in to fill in that gap, to provide access points where access points didn't exist. And I think that needs to continue on as we're, continuing in this pandemic. But those issues are real. We still need to, again, make accommodations for folks who are experiencing those, and do all that we can to make sure people have access, proper access to the vaccine.
Thank you so very much. And Dr. Stanford, I'm going to come to you on a topic that we both have discussed before: distrust in government and health organizations. Dr. Stanford, there's some individuals who don't trust doctors in general or the government when it comes to the care of Black or brown people. Beyond concerns about side effects, many of those that are hesitant just don't have much trust in the vaccines. And then there's some traditional anti-vaxxers who distrust vaccines in general. But I know this was something that you all addressed in Philadelphia. What did you do in Philadelphia to combat this distrust, and how can we replicate that across this country? Dr. Stanford, I think you're muted.
Thank you for that, Sora Star. So in essence, back in March and April of 2020, we learned that African Americans were being diagnosed and dying 3 times greater than other groups in Philadelphia, and that the testing locations you were 6 times more likely to have a testing location if you lived in an affluent white neighborhood. So what that equates to is that Black folks in Black neighborhoods had nowhere to be tested. They couldn't get the contact tracing. And when they showed up to locations, they were turned away. So I started the Black Doctors COVID-19 Consortium, and we, in essence, went to church parking lots and we tested people. I converted my private practice of pediatric surgery into a COVID testing force. And throughout the week, 5, sometimes 6 out of 7 days per week, we tested people in parking lots, graciously shared with us from the churches. And the idea that people don't trust the healthcare system, it's that the healthcare system has been untrustworthy to African Americans. We didn't just wake up one day and say, you know what, I think I'm not gonna trust my doctor. It's because of Tuskegee, and it's because of Holmesburg Prison in Philadelphia, where men were used and experimented on without their consent. It's because of Henrietta Lack. And honestly, it's because of COVID, because when we were dying and saying we need help, funeral directors were being turned away because they didn't have a script. People were being turned away because they weren't in a car in a largely commuter city. So we, with my colleagues of other doctors, medical and non-medical, took to the streets and we tested in the span from April through December over 25,000 people. And when the vaccinations came about, we also provided that access. And so when Dr. Barber talks about the access, and then you couple that with an untrustworthy healthcare system, what the community needed was a trusted voice, and not conversation, but action. And that's what my colleagues have done over this period of time. And for the question about exaggeration, I have to add, because we spend so much time in the churches, the people every week as we're testing and vaccinating, there are funerals, multiple ones every day. And in Philadelphia, those funerals are people who are dying from COVID and people who are dying from gun violence. So I promise you, it is not exaggerated. This is real. It is not a hoax. And the people who are dying primarily are folks that look like us.
100%. And Dr. Stanford, you just put it as plainly as anybody could ever ask. I appreciate your candidness. I'm going to move to the next reason for hesitancy, and I'll ask Dr. Barber if she will take this one for me. Autonomy and personal freedom. This is something that people talk about. I don't want anybody telling me what I can and cannot do. Individuals who also believe the vaccine is some effort to control us and take away our independence via a microchip or the mask mandates, for example, which, you know, I don't want to poo-poo anything, but the fact is most of us walk around with this cell phone attached to our hip at all times. This right here is the microchip that you need to be worried about. If you've got this cell phone with you, they already know where you are. They don't need to put a microchip in the vaccine. But Dr. Barber, will you please address it for me?
Absolutely. You know, I think it's just, unfortunate that these kinds of myths are circulating and that they're, impacting some folks in our communities. And I think about some of the work I've done in, other places, other countries, other contexts. They're not having such an issue with, for example, masking or, even getting the vaccine, right? It's just something about the individualism here in the United States that has just really found its way in, the mitigation strategies of this pandemic. And it's, sometimes I wake up and it's like, are we in the twilight zone? When I think about the ways in which people are so forcefully, in some instances, against some of the recommendations that are being given, again, not to just protect individuals, but to protect whole communities. And so, we need to continue to combat those and address those and debunk those myths with forums like this to provide people with information as much as possible. And again, one of the things that I will say that I think we did a little bit of a misstep as a whole on early on is, not providing people with information, just saying, just do it, just what I say or do it, but not providing them with the data. And I found that early on in the especially with the vaccine rollout, I would go to church community virtual forums, and they just wanted to ask questions. And so continuing to provide forums where people can have their questions asked, where we can debunk those myths, even as we continue to learn about these variants, right? So I think another related point is that as the virus continues to evolve, we're evolving our knowledge on it. We're evolving recommendations, and we need to bring folks along to say, this is why we're now saying, perhaps we need to, reinstate mask mandates, right? Or perhaps we need to, make sure that we're social distancing, et cetera. As we see this virus evolve, and we learn more about it, our recommendations are evolving, and we need to bring the public along with that, right? To help, again, combat some of the myths that are out there. But it's important that we continue to stay vigilant. We continue to provide information and data, and really, meet people where they are in terms of the information that we're giving them.
Absolutely.
If I could just weigh in on that, with personal freedom comes personal responsibility, right? And those are two sides of the coin. And so we know that unfortunately, this pandemic has been politicized. And so when I hear phrases like that, to me, they are buzzwords and catchphrases that really elevate political rhetoric. But even if you agree that personal freedom is very important to you, you must also agree that personal responsibility is. And, you know, for years we have taken vaccines. I'm old enough, we've taken our vaccines for polio and tetanus and rubella. And by the way, we get a booster every 10 years for tetanus. So these are things that we have been doing for years without any controversy, but suddenly they're controversial. And that is just the unfortunate moment that we are in right now, unfortunately, very politically divisive. But we also, again, must make sure that there's personal responsibility included in these conversations. We wear our seatbelts. So Dr. Robyn talked about that. We drive relatively reasonable. We don't drive 100 miles per hour on a routine basis. So we have to accept a degree of personal responsibility here.
Personal responsibility, you said personal freedom requires personal responsibility. Absolutely. And we want to emphasize that that is the phrase for this evening. And I'm going to go ahead and address probably the one thing that there's nothing that we can all do about, and that's the last of the reasons for hesitancy, and that's misinformation and conspiracy theories. At least half the people in the United States, and I pulled this number from the research, says that they won't get vaccinated. Half of the people who refuse to get vaccinated believe at least one conspiracy theory about the COVID-19 vaccines or vaccines in general. And that's according to a recent YouGov poll. How do we address these conspiracy theories and the misinformation? We've talked all around it, and so I really would like all of you to weigh in on this as we move to the next section of the town hall. And Dr. Stanford, you can start.
Mm-hmm. So how we address it is very time consuming, but you got to talk to folks one-on-one. And it's not something where you can have one conversation, but it takes multiple conversations. And so it's not uncommon for us to have a person who will come, just wants to check it out, wants to observe what's happening, and come back a week later. And that's okay. But some of the real things are, I'm going to get this shot, I'm going to die. Like immediately. I've heard people say and mean it, I'm going to turn into a zombie, and mean it. They're serious. That this vaccine is going to give me COVID, and mean it. And some of those things with the fear, if you can show them and they can sit and observe and see that it didn't happen, if they can watch you do it or someone they know and love receive the vaccine and then see them a month later, 2 months later, 3 months later. Sometimes that's what they need. They need to see it. And I think for so many, it's not tangible. You can't touch it, right? So until it gets very close to you, or until it takes away something you love or you want, then it's not really impacting you, because you have other things in your community that you are more impacted by. And that's where your attention is focused, not on this, right? And so that's probably the biggest one that I see is really not looking at or thinking, you know what, or thinking to yourself, this is crazy, but really listening to people because they believe it, like wholeheartedly with every fiber of their being, what they believe. And so I listen before I speak and see where it is, because sometimes it's just misinformation. I had a woman say to me, I had an allergic reaction when I got my hair dyed, so I thought I couldn't get vaccinated. Something as simple as that I could say, no, that's not true. And we're going to watch you even longer and make sure nothing happens. We have an EMT here. If you need anything, we could administer it. That was all it took. So it takes time, but you got to listen. And it's not going to be a quick conversation.
Thank you so much, Dr. Barber. How do we address this?
I mean, I think it's similar. And I just want to say, Dr. Ala, or Sora Ala, that you are truly an angel in Philadelphia, and all the work that you and the other doctors have been doing is so powerful. But again, I think it takes that listening, that compassion, and you can't beat people over the head with this information, right? You can't just ram it down their throats or beat people over their head. You have to communicate that. And one of the ways I do that as an epidemiologist is with the numbers. I say, Well, if you really take a look at the numbers, for example, if you think about the breakthrough deaths and hospitalizations, it's a very small fraction, of people who've been vaccinated, right? So using those numbers, the conversations, and again, being fully transparent about what we know and what we're still learning, and being honest about that as we have conversations with folks in our communities.
Yes, indeed. And Dr. Harris, you can wrap us up on this particular section.
I agree. I think we do have to meet people where they are. And I always ask a lot of questions when someone comes to me with something that I believe is misinformation. I often ask, where did you see that? Can you let me know where you found that bit of information? And then I try to just go step by step to say, well, that's a person who is not a public health professional or a physician. They are just on social media. So again, it's meeting people where they are. I agree. As frustrating as though it may be, and I think at least let me just say, I'm going to own that because it is frustrating sometimes, but I do try to meet people where they are and then slowly guide them to make sure they have accurate information. At the end of the day, someone may have all the accurate information, the science and the evidence, and still decide not to get vaccinated. I'm going to respect that, but I definitely want them to make that choice. I will still encourage them not to do that and to get the vaccine. But the key is making sure they have credible information. I also wanted to just say a little bit about access, because we've talked about access to vaccines, and I also want to applaud Dr. Stanford and many others who just sort of said, we are going to make the right thing to do, the easy thing to do. We're going to go to the community, and you may not have a car and you shouldn't have to have a car, and we're going to make sure we are in your neighborhoods, which is why, again, in the interest of full disclosure, I am co-founder and the CEO of a company that's bringing testing to the home, a digital platform, because right now we need, again, all the mitigation strategies. As was said earlier, I think that Dr. Robyn said, testing saves lives, vaccine saves lives, wearing your mask saves lives. So it's all of these layers of protection and mitigation that we need to continue to implement.
Thank you so much, doctors. Dr. Soares, I just appreciate you batting down the hesitancy issues, but not in a way that is unkind or dismissive, but that is in a way, as you all have said, is listening and trying to address what those fears or concerns are so that you can make an informed decision for your own health based on real facts. And so for this next section, I just want to take the next 15 minutes to just hit some factual questions, just so that people have some of that information that we've been talking about. So Dr. Harris, I'll come to you first. Tell me, how many variants are there and how do the variants develop?
You noted this early on, first of all, that this is not unusual, right? Viruses mutate. That's what they do. However, I have to say, I give this SARS-CoV-2 an A+. And by the way, we are helping this virus mutate, because the longer many of us, those of us who are unvaccinated, stay unvaccinated, that allows the virus to replicate. But again, listen, all of us do what we need to do to survive, right? We eat, we drink water, we do what we need to do to survive. And that's what this virus does as well. And so that's part of nature. Viruses mutate. There's a change in their genetic code. Now, some of these variants, and you gave a great introduction, are not clinically significant, right? But Dr. Robyn talked about some that are clinically significant. And of course, we see this Delta variant that is more virulent, as Dr. Stanford said, which means it's stronger, it's more infectious, it can infect more people. And unfortunately, we are seeing this virus have an impact on our younger children. Now that could be in adolescents, and that could be because of the vaccination status. It's most likely, again, due to a number of factors, but this is what viruses do. They mutate, and the best prevention the best protective measure against further mutation is those of us who everyone should get vaccinated. And I have to say, I think language is important. I am not in love with this is right now a disease of the unvaccinated, because the unvaccinated are making an impact on those who are vaccinated. So that's one phrase that I'm not fond of. But again, we have, as Dr. Robyn said, some variants that are variants of concern. The World Health Organization, the CDC, there's about 3 or 4 of those, but she mentioned there's probably over 13 variants. And those are the ones that we know. There will be more to come. Again, that's what viruses do. And we are not helpless though, right? That's another thing that people sometimes feel, and I know people are tired and they want to get back to normal, but we are not helpless, and we can do what we need to do, which is get vaccinated, wear a mask, watch our distances, and get tested when there are outbreaks.
Thank you so very much. You know, I have to tell you the number of variants that we were all talking about, and I said for those who decided not to pledge a sorority or fraternity, they're learning the Greek alphabet during this whole phase, because we're up to Lambda right now. So I'm just being prayerful, okay, that we cut it off at the knees. So Dr. Stanford, you know, I have to keep it a little light at some point, okay?
Yeah.
Dr. Stanford, okay, a quick factual question to you. What the heck is a breakthrough case of COVID? And how common are they? Because like the disease of the unvaccinated gets on Dr. Harris's nerves, this breakthrough phenomenon gets on my nerves.
So I personally think it's a misnomer, because it implicates that it didn't do what it was supposed to do, the vaccine. So as Soror Harris said, the vaccine is supposed to prevent you from getting COVID, or when exposed to COVID, that you have a mild illness. Also, if you're exposed, keep you out of the hospital and prevent you from dying. That's what it is supposed to do. And the vaccine efficacy, and I'll just talk about Pfizer, was 95%. That means that 5% of people, even after receiving both doses, fully vaccinated, 2 weeks after your second dose, or Johnson & Johnson, 4 weeks after your first dose, fully vaccinated, some people will not have the vaccine efficacy. That's 5% of people. Then you add people who are immunocompromised or immunosuppressed. They are not going to mount the same strong, robust response. And so when we talk about these cases that came through, many of them were mild. I believe you heard Soror Robyn say of the over 300 million that 1,250 cases have been documented, which if someone did the math is probably less than 1% of cases that have happened. But you don't hear the full story of what other conditions a person may have if they were fully vaccinated. I have plenty of people that are like, oh, I'm about to go to the South. Let me get my shot real quick, right? Presuming that they're going to somehow be protected because they just got their shot. All right, let me make sure I got all my notes here. Yes, and one of my sorors is texting me that someone commented about natural wellness. It's important, and you should exercise. You should eat healthy. You should take care of your body. No one is suggesting that you shouldn't do that, but none of those things will prevent you from contracting coronavirus. None of those things. So it's not either or. You do those things. And the other thing, and this is probably the biggest, all of the research that was done on this now FDA approved Pfizer vaccine, and I'm just going to use that one for example, was on the Alpha variant. Okay. So when we hit April, May, June, and we had flattened the curve and it was coming down and you had all these mask mandates being removed and so forth, it was because people were rushing out to get vaccinated. And then we got to the group of folks that weren't sure. And that was at the same time that the Delta variant was coming from India primarily, right? And we went from the Alpha variant being our primary variant of COVID to the Delta variant taking over. So when you see these, quote, breakthrough cases, they are people with Delta, which is over 95%. And Sora Barber can correct me, but it's over 95%. You hardly even see Alpha variant anymore. So before you say, I'm not going to get it because I'm going to get COVID anyway, you have to know how we got to this point and why we're seeing those cases now.
Yes, and I'm glad you pivoted to Dr. Barber, because Dr. Barber, I'd love for you to go ahead and address that in addition to my question of how you respond to the counter argument of the unvaccinated who contend that vaccinated people are as susceptible to passing and catching the virus as the unvaccinated. So that really does pivot off what Dr. Stanford was just talking about.
Absolutely. Again, echoing the fact that there was always the possibility of getting an infection from the virus. But here are the numbers. I want to give some numbers that actually add to Sora Robyn's numbers earlier. So 168 million fully vaccinated people, 168 million fully vaccinated people. Out of those individuals, 1,829 deaths, 7,887 hospitalizations. That's less than 0.01% or something. I did the calculation on myself.
Hit the numbers one more time for me.
Yeah.
I want people to hear the actual numbers.
Absolutely. And this is from the CDC. This is where they've been tracking 168 million fully vaccinated individuals here in the United States. Of those individuals, we've only had 1,829 deaths and 7,887 hospitalizations among fully vaccinated individuals. So again, and what we're seeing is that the largest, by far the people who are dying at this point from COVID are those who are unvaccinated, right? So the numbers are bearing it out. And as Sora Alice said earlier, the number said 95% effective or efficacious. And so we're seeing, what we would expect, given the data that we had during the trials, right? And so I think that's really important to note, as we're seeing it. And again, as we're seeing, we're learning about this Delta variant in addition to the vaccines. I think it's also important that public health measures, we begin to kind of, implement those measures so that we can mitigate. So we have the layer of the vaccine, the layer of things like restrictions in restaurants, et cetera. On top of that, to again, slow this kind of spread down in this point where we're, and especially as we're going into the fall and winter. I think this is going to be really, really critical.
And speaking of slowing the spread down, the Biden administration, Dr. Harris, I'm coming to you, has decided that most Americans should get a coronavirus booster vaccine 8 months after they've received their second shot. And that could begin offering the third shots as early as the third week of September. So we're really looking at literally a month from now. Are booster shots necessary? And tell us why, because there are a lot of people that are asking this question.
Yes, and based on the data, and by the way, this is not a surprise. I imagine all of us on this panel, if you go back and look at tapes of us on TV or on these panels, we talked about the fact that we're likely to need a booster.
You certainly did with me, and we did this when it first started, and so I can pull the tape for that one.
Exactly. And so because I like to do that because this is scary. Listen, there's no question that this is scary and this has been traumatic for all of us. But I like to sort of normalize, this is not normal. A pandemic is not normal, but the expectation that we might need a booster is not a new phenomenon, right? And I've already talked about tetanus, and we need a flu shot every year because there's a new virus that is circulating that causes most flu cases every year. And so based on the data, again, and it's not unexpected, our natural immunity wanes from lots of things, and it will. And there is some concern. And Dr. Stanford just said, a lot of the data and the research was on the Alpha variant. This is the Delta variant. So very smart, bright people are looking at all of the data. And and being proactive. You know, that's what we have been in a reactive mode when it comes to this virus almost the entire time, catching up to testing, catching up to everyone getting vaccinated. But this, I believe, is a very important step, looking ahead, looking at the data and saying that it is likely a good idea. Of course, the Biden administration has recommended, as you note, that we will need a booster. Clearly, a lot of folks are saying we need to prioritize those who are immunocompromised or immunosuppressed with that booster, but we have enough vaccine. And so when it's my turn and it's appropriate, I do plan to get the booster because I want to get into the Atlanta Falcons football stadium, lightening up a little bit. Sora Star, we all want to get back to doing the things that we enjoy doing. And we are, we are not helpless and we have to act. And if it requires a booster, we should get the booster.
I want to get the booster so that we can go to Boulé and put our arms around each other again and not have to do a fist bump or an elbow bump. So I'm looking forward to that time also. I completely agree with you. Dr. Stanford, I'm going to come to you because I do want to get something specific for the parents that are out there. Would you recommend the vaccine for young children under 12 when it does become available to them?
So I plan to look at the data from the ACIP, the advocacy committee from the CDC immunizations program, like I have the whole way through. I have 11-year-old twins and I want to be sure. And, but with the pediatric dose and folks are like, why not? Why isn't it here? Why don't they hurry up? It's different. The physiology for a child is different. You cannot rush it. The dose has to be just right. The amount that I receive as a grown woman is not the amount that a 5-year-old should receive. And you have to do dose trial data of different doses so that you get the maximum vaccine efficacy with the minimum adverse reaction. And that has to be perfect for our children. So while I wish I didn't have to double mask my 11-year-old twins who hate it, I want to make sure it's safe when it comes out. And the fact that I've received it gives me a sense of security, if you will, because I've already had it. And I wouldn't put anything into my children that I wouldn't first give to myself. So my answer is yes, after I've thoroughly looked through the data as I have this whole process. But we've got to protect our children because they are contracting it primarily from unvaccinated adults. And until we get a vaccine for them, we got to keep them in masks and protect them.
Mm-hmm. So I see all the Soras are shaking their heads, so I know that they agree with you. Everyone on this panel, all of you, and just let me compliment you in this way. You are data and science driven. Every single answer to every question is based in the science and based in the data. And it's extremely important that our community in particular knows that this is not a willy-nilly discussion. This is a discussion about our long-term health that is based in science and data. And I just want to be very, very grateful. I want to express my gratitude in the manner in which you all have approached this, which is, I know of your work over years. Dr. Harris and I have worked together several times, and you have been, all of you have been very consistent talking about the data and the science, and that's just been magnificent. So we only have a few minutes left. I would like you all to weigh in on what we should and should not be doing to curtail the spread of COVID-19, regardless of vaccination status. Dr. Barber, will you start us out?
Absolutely. As I said, we're about to enter into the winter months, into the fall. This Delta variant is definitely it's on the rise. It's primary here. And I do think that this is where we kind of relaxed over the summer. You know, we needed to kind of like shake off the past year. You know, I think it is, important for us to begin to take, measures that will, again, protect ourselves, protect our families and communities. So, I, for example, personally masked when I'm outside, when I'm indoors. I am trying to avoid crowds, large crowds at this time, especially as we're still learning about the Delta variant and its spread. And so I think those things need to be implemented. I also think that because I'm in public health, we need to be doing things as individuals as well as things as, implemented by different entities, whether cities, states, and local governments or federal governments. So some of those restrictions may need to be put in place as we're moving through the fall months. Again, restricting the capacity of restaurants, restricting some indoor activities as well. Because again, we need every layer of protection. Vaccines work, but we need every layer of protection, both biomedical and public health, in order to combat this, in order to get to some sense of normalcy over the coming months.
Dr. Stanford, what would you like to add?
I was over here jotting down my question. Okay, what you should do is listen to facts from credible sources, please. If you have been vaccinated, that's step number one. But if you have not, if you know someone who hasn't, make it your responsibility. Commit to listen to why they have not been. And if and when they decide, go with them. Because even for me, getting my heart did race a bit in December. And so I would say factual information and listen to we all have someone in our family, in our circle, take them. What you should not do is, because you had COVID, do not think that will protect you. Because we now know that someone who is vaccinated versus someone who had COVID are 2 times more likely to get COVID again versus someone who's been vaccinated. So that idea is not true. However, if you had COVID and you get vaccinated, you have a boosted immune response. And finally, if you decide not to get vaccinated after you've heard all the facts, please stay away from our vulnerable. Please stay away from our children who can't be vaccinated. Please stay out of crowds, and please wear your mask.
Personal freedom requires personal responsibility. That brings me to Dr. Harris.
Star, I would say what they said, but let me also note that we should all remember self-care and to take care of our mental health during this time. This has been a difficult time. It's okay not to be okay. There are days when I'm not okay. And in addition to COVID, we've had the other issues around the racial injustice. And so I would just remind everyone to take at least 15 minutes out of their day to focus on themselves. I know as women, as Black women, we sometimes want to live up to the concept of the strong Black woman, and we are strong, but being strong means taking care of ourselves. And so we should give ourselves the grace and the space to feel our feelings and make sure we are taking care of our own overall health. And that includes our mental health.
You know that I was coming right to you with that as the wrap up to ask you about our mental health since I have you on this panel. Ladies, you have just been phenomenal. Absolutely phenomenal. And I see just from the ongoing chat from our audience, our sorors and our guests today, how grateful they are. Is there anything that you'd like to add as we come to a conclusion? I'd love to give you all just one final word. And Dr. Stanford, I'll start with you.
This will be finite. Remain hopeful, prayerful, and positive. We have the power to do this. So keep your head up.
Dr. Barber?
Just Ubuntu, which means I am because we are, and we have to make sure that we all get through this on the other side. There's so much work to do, and it's been an honor to be on this panel with each of the panelists. Thank you.
Thank you both. Dr. Harris, your final words.
We will get through this. We will get through this together. Ultimately, we will be a part of shaping a transformed normal as we think about public health and mental health and our overall health on the other side of this pandemic.
I have to tell you, I'm just so proud of the fact that we're all sorors, that you all made the decision to become members of Alpha Kappa Alpha Sorority Incorporated. You're not honorary sorors, which we love and appreciate our honorary sorors, but you all understand how important it is for service to all mankind, and it was a part of who you are and who you became. And so I'm just honored to have been here with you this evening. As we wrap up this evening, I just want to say thank you. Thank you, SOR doctors. Thank you for your expertise and what you have brought to the table this evening. As we wrap up the evening, I'd like to again thank all the presenters who did obviously an amazing job. And I, of course, want to thank our international president and CEO, Dr. Glenda Glover, and the Alpha Kappa Alpha COVID-19 Pandemic Task Force under the leadership of Joy Elaine Daly, International Regional Director, and Kimberly Esmond Adams, International Risk Management Committee Chairman, who also is our executive producer for all of our virtual series, and she is my partner in all things. I want to thank them for their hard work and commitment to ensuring that the members of our organization and the communities we serve are abreast of the ever-changing dynamics of the coronavirus and the pandemic in an effort to protect our members so that we can continue to provide service to all mankind and exemplify excellence through sustainable service. To close out our evening, please just allow me the opportunity to say that it's clear that vaccines are a critical tool in the battle against COVID-19, and there are clear public health and life-saving benefits to using the tools we already have. So we don't want to put off getting vaccinated because of our concerns about new variants. We want us to proceed with the vaccination if you can discern the science and the data. And that's what we try to do for you this evening. That gives you the tools that you have in your hand. And we're going to continue to try to improve those tools, but we want to make sure that everyone is safe. On behalf of the leadership of Alpha Kappa Alpha Sorority Incorporated, I want to thank you for joining us, and I wish you a great evening. May you, your family, and your loved ones continue to have health and to have hope. Thank you again.